Hello everybody, and welcome to this training session on the Physiologix sports tapes and products brought to you by Fleming Medical. My name is Darragh Kennedy and I'm a physio here, and I work with Fleming Medical on their sports therapy and first aid services for a number of years now. So today we're just going to go through a presentation and some quick demos on tapes to help you understand what they're used for and why they're used, and then hopefully you'll have a better knowledge, so when that person coming through that door has a few questions for you, that you can sell them the right product at the right time. So this is just quick info on myself. Darragh Kennedy is my name, and I'm working here for Fleming Medical on the training. So my experience, a lot of work in sports and particularly physio with sports teams, and use a lot of these tapes on a very regular basis. So hopefully you can pick up a few little bits of knowledge today that will help you when you're at work and people are coming through into your pharmacy and they want to know which product they should buy and for what reason they should buy it. So just an overview today. So we look at strapping tapes, when you should use it or what they're for. Sprains and strains, just to differentiate between the two. The R.I.C.E method for managing acute injuries or recent injury. Then we'll talk through three of the tapes within the range: the Kinesiology, the sports stretch tape, and the Zinc Oxide tape. And we'll try and do just a quick practical demo so you can see how the tapes are used. And we'll talk about some of the other products then that can be used and sold with these tapes for use in sports and first aid scenarios. So what are tapes used for? Managing sprains and strains. We'll talk a little bit more about them in a minute and what a sprain is and what a strain is. But that person with maybe a minor injury at this stage and wants to keep playing or get back playing. Securing ice packs, we'll talk about that a little bit more when we go through the R.I.C.E method. But when you have a recent injury, like on that day of a game or activity, or maybe even work related, and you're applying an ice pack, it's much better to use a compression bandage with it as well for a number of reasons. Injury prevention or re-injury prevention, maybe that they want to get back out playing and not roll that ankle again, not sprain that thumb again. They want to keep playing as much as possible, or they have a big game or match coming up and they want to get ready for it, and they want to be able to train and play in without getting re-injured. And also then protect skin and prevent irritation. So with the tapes we have that they can have use without causing issues such as skin rashes and the likes, so that person can wear them for the required duration of time, and that they've no negative side effects from using the tape, such as a skin rash or even a cold burn, things like that, where they feel safe in using the product again and again. So what you can get from your rep is this reference poster. So we've devised this poster. It has a summary of pretty much everything we're going to go talk through today. When you should use it, the types of strapping, the strength of the tape, the sizes, the colors, a sprain, a strain, the features of the products and benefits. So this will be available to you from your rep. You can get a hard copy or soft copy, and you can use that then going forward. It will back up the information that you're supplied with today, and you can use that to familiarize yourself again with the products, particularly if someone is coming into your pharmacy and wants to know which product they should or shouldn't use. So we're going to give a bit of background information first. So sprains and strains. So a sprain refers to a ligament injury, so either a stretch or maybe an overstretch or a tear in the ligament. So a ligament is a kind of a form of connective tissue that doesn't really like to be stretched or torn, and they give the joint stability. So if you sprain a ligament, that joint then will have a little bit more instability, along with added pain and movement issues. So we want that to heal and manage it that way, but we also want to prevent it reoccurring. So what we do then is we use tapes then to help that person keep that joint stable and prevent the injury from recurring. A strain then refers to a tear or a stretch in a muscle or a tendon. So these soft tissues that attach in around the joints above the joints, below the joints, that give you movement. Okay, so they can be damaged through direct blow to the area, or maybe too much force or too much fatigue within the muscle, and the muscle fibers tear, and they can't run, they can't walk, they can't lift their shoulder, they can't move their wrist, etc. So the muscles and ligaments, strains and sprains, they both can get commonly injured in sporting activities, also in work-related activities, or even in the home. And we will talk about how and when you can use the Physiologix sports tapes brand and range to help them get back to sport and help them get back to work and stay in their sport and work. So we're just going to quickly talk about the R.I.C.E method. So when someone picks up an injury such as a strain or a sprain, we generally follow the R.I.C.E method for the first day or two, or even 3 or 4 days possibly, depending on their symptoms. So rest is what R stands for. So we stop them doing what aggravates it or what caused it. So we don't want to put weight through the joint. We don't want to keep doing the activities that aggravate the injury. They may cause further damage, but they will probably also add to the pain and the inflammation. So that person who maybe rolls their ankle playing soccer and needs to come off, they need to stop all the twisting and turning, because they're going to keep aggravating that injury and possibly doing more damage to any injured ligaments, for example. Ice, so we will put ice or cold in around the injured area for maybe 15 to 20 minutes every 2 to 3 hours. This is plenty. We don't need to do any more. This will help them with the pain, swelling and bruising and the likes, and help that person manage that first few days where they're in quite a lot of pain and dysfunction. Okay, we'll also use it with a cold compress such as our sports tape to apply the ice pack to the area. So we apply the compression tape in around the injured area, then put the ice pack over it, and then we compress then over the ice pack with the tape again. So we prevent something like a cold burn or a blister on the skin from putting the ice pack directly on the skin. Compression, so when we have an injured joint or soft tissue, we compress it. It'll help limit the swelling and the movement. Remember, we don't want to aggravate the injury, and we can vary the compression there, whether you want a small, medium, firm or extra firm compression. So it's really just trying to help them manage through that acute injury phase in the first couple of days. Then elevation, we're really just trying to take strain off the injured structures, maybe raising the leg up with an injured ankle there, for example, so you're not aggravating it anymore, and help reduce any further swelling. So the first tape within the range we're going to talk about is the Kinesiology tape. So we can see here some of the product features. It has light compression, it's highly elastic, it has low to medium adhesion, and it's highly flexible. So it's designed to provide support, lessen pain, reduce swelling, improve circulation, and strengthen the range of motion during sporting activities without restricting movement. So that's important to remember here, is that it's not really going to restrict your movement very, very much. It's quite a light tape, and it's very, very elastic. So it's not really going to provide a huge amount of rigid, strong support to a joint or soft tissues. So it can be used, we'll say, for joint strapping, and it can also be used for muscle strapping, so for strains and sprains. So we will do a quick demo of this in a minute to give you an idea. You see there, it's in 4 colors. The colors make absolutely no difference. That's a common question people get. It's really a matter of personal preference as to what that person wants. Generally, the black and the beige tape tend to sell probably the most. But people do have the option then of getting the blue and the pink there as well if they want. The big advantage of this tape compared to the other tapes is it can be worn for up to 4 days. So they can wear that tape, at night time in the shower, and it won't come off. So there's good level of adhesion and conformability to the skin and to the joints of the tape, and you're giving them that little bit of support for a couple of days if they want that. You can of course just decide to wear it for their run, for their match, for their duration of work. It's up to them really, but you get the option of wearing it for up to 4 days. It's latex free, it's breathable and sweat resistant. So they all are some of the reasons why you can wear it for up to 4 days. and we will now do just a quick demo of it in a sec. We will look at just how it's cut and applied, and that person really needs to know what they're doing themselves. The 4 products there, they're all 5-meter rolls, so they're standard size, 5 centimeter width by 5 meter long, and they're available in 4 different colors. Hands, feet, legs, shoulders, it all really depends what they want to apply it for. You'll see this slide here. You can see there on the left hand side, it's been used with an ankle sprain. So it's there just giving a light bit of support to a previously injured ankle. It's not going to give it rigid support where it locks it down and limits movement, but it's going to give it a little bit of support and maybe assist in some of the movement. We can see there tennis elbow, some of the strips applied down the forearm muscles where you get tennis elbow. Low back pain, see across the area of the low back where they get pain. Shin splints coming from the foot all the way up the tendons of the lower leg behind the shin. So it's taped up from where the muscle starts and ends in that example. And jumper's knee then, where you have an irritable tendon in around the knee, and it's applied on the tendon of the knee to give some relief. So I'm just going to do a quick demo now of the Kinesiology tape. So this is the black one we have sampled, and you will need a scissors with this. Okay, so we have the black tape and we have a bit of backing tape on the back. Okay, so you can see a grid on the back as well. So that gives someone an idea in terms of maybe the length or the width they want to cut. They may want to cut 10 squares, so they can count 10 squares down, and there we have it's a standard length that they use for the application. They may want to cut 15 squares. So it really depends what they're doing. So it gives them a bit of a reference point and a gauge as to what they're going to do. You will often see people just cutting the edges of it to round off the edges. The advantage with this is with the grid in the middle then is you can follow that line down the middle if you want to cut it into strips. So if I want to cut this in 2, I can cut all the way down the middle. I can cut all the way across. Okay, you know, I have a strip of tape that's half the size. Okay, so there we go. There's a bit of flexibility. If I want to cut that even again into smaller pieces, it really depends on what that person wants. Okay, you can cut it all the way up. Okay, and into smaller little strips. Okay, so cut it up into whatever length and whatever width you want. So there we go. A nice small little strip if you wanted to use it for someone's fingers, for example. So we'll do a quick demo. So I'm going to cut it with my scissors to a desired length, okay? And I'm just going to cut the edges so they're nice and round so they don't lift at the corners when it's applied. So simple strip of tape, okay? That's my desired length. I'm going to apply it like I would for, I'm going to imagine I have tennis elbow here coming down my forearm, okay? So what I do is I rip off the backing tape from the top of it, peel it back a little bit. So you do need to know what you're doing, okay? And I'm going to apply that right there where my tendon is inflamed, okay? And then I'm going to apply it down the length of my arm, okay? I put a bit of tension on the tape, okay? And then I take off the backing tape at the end, and I press down to get the glue nice and working. So what this tape does then is I move my wrist. These tendons will be inflamed and sore and painful. So as I do that, it's giving me a little bit of assistance. So for example, in tennis elbow, in this example, muscles come from here, cross the wrist, and I'm giving this tape a little bit of assistive support. That's pretty much it, okay? We can apply more. We can cut them into strips like we saw in the photo. We can apply more around the arm in the opposite way, around the arm, to take a bit of strain off the injured area. So it's quite flexible and adaptable. You do need to know what you're doing, okay? That person will have been shown how to use it. They will have probably tried it before themselves. They will have maybe have gone onto YouTube and seen some of the videos as to what they do. So 5 meters long, loads of uses out of it. They will get plenty of use out of it. So that's that's a good quality tape that they'll get plenty of use out. That can stay on then for a couple of days. They use whatever strip they want and they put that back in their bag or in the box, and they can use it again the next time. So that's kinesiology tape covered. The next one we're going to look at is the professional sports tape. So it's an elastic tape. It's a self-adhesive tape, so it means when you apply it, it sticks to the skin itself and sticks to the tape itself, which is what you want in the scenario you're going to use it for. And it's used to compress an injured muscle or joint. So it can be used for muscles and joints, or to provide support to an injured area. So when we talk about that, that's in the case of maybe the first aid scenario, where someone maybe pulls their calf muscle or their thigh muscle, and we put a bit of support on that area, and then if we want, we can put the ice pack over it and secure the ice pack down again with the tape. So it has a couple of uses. We have it there in 5 colours and 4 different sizes per colour. So that option there, that they may choose a red one because their jerseys are red and they may want to just look the same. Same with the blue. The most popular ones tend to be probably the white and the black, because that tends to be what is used most often. So it's an elastic material, it has good adhesion, and it's quite flexible. Okay, so we can vary the tension when we put the tape on to give light compression or heavy compression or medium compression. So it's quite adjustable and variable, and it's up to you how much compression you want to use with it. It's easy to tear, so no need for the scissors. So unlike the Kinesiology, you don't need the scissors, which means ideal in a first aid bag or a similar scenario, that you just open it and you can tear it to the desired length. It can be used to secure ice packs or dressing, so we advocate using it with an ice pack because you will wrap over the skin first to provide compression, then put the ice pack over the initial layers of tape, and then you secure the ice pack down again with more layers of tape. So you get your compression and your ice, and you're not running the risk of somebody getting an ice burn or a cold blister. And it conforms to the body part that is being taped. So for example, it's quite stretchy, you can vary the tension. We have it in different sizes, different widths. So for a thumb versus a shoulder, we have a different size. For ankles and knees, there's all different sizes, and you can vary the tension to wrap around the body part, whether it be your thumb, your shoulder, your knee, your elbow. Just so the range of products there gives a lot of variability and flexibility to use. And so there we have it there. We can see there each product, there's 4 different colors. Like we said there they are with the product codes. PX is the initial the product range, Physiologix, and all the product numbers beside it. So blue, beige, red, white and black. And then we have it in a 5 meter standard roll again. It's always 5 meters, so they will always get a 5 meter roll no matter what size or color they get. And we have it then in different widths: 2.5 centimeter, 5 centimeter, 7.5 centimeter, and 10 centimeter. Your biggest sellers would probably be the 5 centimeter and 7.5 centimeter. If you want to know where these are used, if anyone turns on a rugby game and sees the guys with all their heavy tape all over their leg muscles, particularly the guys playing in the forwards, this is the type of tape that they use. It's elastic, it sticks well, it will last for the game. It's stretchy and it conforms to their muscles can contract and expand as they run around, and it doesn't limit them too much. So, for example, the 2.5 centimeter, and we'll do a quick demo in a while. Fingers, thumbs, wrists, things like that, smaller joints. It's ideal for. And then as we go up the size guide, 5 centimeter, 7.5 centimeter, knees, elbows, shoulders, and maybe the 10 centimeter for shoulders and back. So the bigger, bulkier guys and the bigger joints you have to strap, or if you're strapping around the torso, a 10 centimeter one might do you, or might be needed. So I'm going to do a quick demo on those and show you exactly what they look like. So we have them. These are the boxes. That's a 10 centimeter in red. You can see the color is always on the front with the description there. The 10 centimeter above 5 meters. So the size, the length, and the width is always there. This is 7.5 centimeter in the red. This is a 5 centimeter in beige. You can see there the color guides. Then we have the 2.5 centimeter, okay, in white. That's in white. So it's written on the box. All the features there that are in this reference chart, some of them are written on the boxes as well. Okay, what you might use them for, precautions, instructions for use. So if you're looking for a quick reminder, you'll often find them on the box as well. Okay, so this is what maybe a white 7.5 centimeter one looks like. This is probably one of your popular sellers. between the size and the color. So I wind it back. Okay, so you can see there's a little bit of tension on it, and I wind it out, maximum tension. So as I wrap around something, I can decide to put minimal, middle of the range, or maximum tension on it. So the max tension means I'll get max compression. Okay, and if that's what you want. Some people may want, for a minor injury, just a light little bit of compression. Okay, so we can see here, rip it across. Okay, the advantage of that being easy tear means you don't have to use the full roll, and you don't need to pull scissors out of your bag, which is just awkward at times. So you'll apply it straight away to an injury. If someone, say, gets a dead leg or pulls a calf muscle or whatever, you want to apply a bit of compression. Open the box, take out the tape, and wrap it around the injured area. Wrap till they feel comfortable. You don't want to put too much compression on it to cut off the blood flow completely, but you wrap it to your desired length, and boom, there you go. Off of, and then you can put the rest of the roll back in your bag, which means you can use it again. Okay. This one is your 5 centimeter one, so this may be more suitable. So if we look at, maybe if I want to strap up an injured wrist, I sprained my wrist, but I want to play my game at the weekend. I still want to be able to catch the ball. I want to be able to do X, Y, and Z. So there we go. That gives me wrist support. It's like a wrist support that you might buy in the pharmacy anyway. It's just a temporary one. There we go. That limits my movement, gives it support, and I can feel it's quite sticky. Okay, you see it. It very quickly sticks to itself to take it off. So that's what you want. And again, it wants to be a good level of adhesion, that it's not going to come off with sweat, or when I move a little bit, that it's not going to come off easily. Okay, so you saw there, I could rip it quite easily across it, and it sticks to itself, and away we go. Okay, so that's, the 5 centimeter in the blue there. Here we have the 2.5 centimeter in the blue. So I'm going to just do a quick demo of a thumb strapping. Okay, so I'm going to attach it in around my wrist, and this is what ideal for thumbs. We wouldn't use any bigger tape because it'd be just too big to get around the thumb, and I'm just applying a kind of a stability, kind of support to my thumb, and we'll show you now in a sec. So here I have wrapped around a couple of times, secured across the wrist. There we go. My thumb is nicely and secure. You can see there, nice bit of strapping. Even, it gives me some movement, but doesn't give me complete limitation of movement, because that's generally what you want. You still want to be able to use your digits or your joints or your fingers in a sporting environment, but you just don't want to, say for example, I don't want to move my thumb too much because I've sprained it recently. And I want to play next weekend. I want to be able to tackle. I want to be able to catch a ball. I want to be able to manipulate something at work. So there we go. So that will stay on for the course of their sporting activity, and it should stay on and for their hour or two or whatever, and then we can just take it off. Okay, so, and then we take off the wrist one. You see there, it is quite hard to take off, which is kind of a good thing. Might be a little bit uncomfortable, but that's what you want. Okay, it's quite adhesive, so taking it off can be a little bit uncomfortable, but that's what people will do, and that might be the only complaint they'll have. But it just proves that it's quite a good product and quite a good level of adhesion. So that's what mainly what the professional sports tape is used for. Like I said, the other example is where you will use it with an ice pack, where you might wrap around. I might wrap around, and then so if I put it on my hand, and I might have injured my hand, and then I will put my ice pack here, and then I will apply the tape over the ice pack again. Okay. There we go. Rip across it. There we go. So you're not putting the ice pack directly on the skin. You're getting your compression, and you're getting your ice. Okay, and you've no risk then of a cold blister or a cold burn. So they're the sports tapes. Okay, quite multifunctional, quite a good product, very good adhesion on it, good conformability, easy to tear, used for acute injuries and also then for strapping and compression of muscles and joints. The last tape then in the range is that it gives even more compression. It's called Zinc Oxide tape. It's a rigid tape, so it has really no elasticity in it. And and it's really designed to limit movement particularly, whereas the kinesiology tape doesn't really limit movement. It might assist movement. The professional sports tape, you can vary the tension on it to provide some bit of limitation to a higher degree of limitation, whereas this tape is really designed to restrict movement or limit movement. Okay, you will see it. I will go back again to the rugby example. If anyone has seen the players coming off a pitch with maybe their shoulder, a lot of brown tape in around their shoulder, that person has had their shoulder strapped and stabilized for the course of a game. You know, the same with someone with an ankle sprain. They will have their ankle stabilized and strapped for the course of the game. You tend to just use the professional sports tape and the zinc oxide tape for the course of the event and take it off then. Prolonged use may cause a bit of skin irritation, as opposed to the zinc oxide tape, to the kinesiology tape, which can last for up to a couple of days without causing any skin irritation. So this is a highly rigid tape and it limits movement. That's the goal of it, okay? High adhesion, high rigidity, and it restricts movement. That's what we want. And that's the goal of it, and that's what that person is looking for. The person coming through the door into a pharmacy, kind of like the kinesiology tape, will have had their ankle strapped before. They will know exactly what they're looking for. They will have looked online for training videos on how to strap up their own ankle or their own knee, or they may have been to a physio who has showed them the basics of how to strap themselves up. Okay, that's that person. You may get local therapists in the area who may want to buy some of the tapes as well. They will be involved with some sports teams, and they may need tapes for matches. So it's easy to tear again. No need for the scissors. Okay, we'll show that. We'll demo that again. So you tear across it, which gives it rigidity. You can tear down it as well. It's designed to tolerate human environments and friction. It conforms to the body part. So you do need to know what you're doing to make it conform to the body part in terms of the way you strap an ankle, the way you strap a knee, to limit movement in the right direction. Okay. Assist in preventing injury. So that person who sprained his ankle recently, they don't want to sprain it again. They may use a bit of strapping for a while until they get fully back and they're fully rehabilitated. So it's in a couple of shapes and sizes and colors. It goes all the way up to 7.5 centimeter down to 1.25 centimeters. So the smaller ones, ideal fingers, etc., thumbs, whereas then, you know, and the same with the 2.5 centimeter. Then as we go up, the 3.8 centimeter, 5 centimeter, 7.5 centimeter. So 7.5 centimeter might be more suitable for a shoulder strapping because it's a big bulky joint to strap. And the 5 centimeter and 3.8 centimeter will sell knees, shoulders as well, ankles, elbows. The most popular seller will be the 3.8 centimeter. It's one that's used most for ankles, knees, which will be the majority of it. You can actually, even if you want to use it for shoulders as well, you just may use a little bit more. So we have it in the white and the tan color or beige color. Again, there's no difference in them. Like the kinesiology tape, there is no difference in the color. It's just a personal preference. And whatever size they want or whatever color they want, then it's up to them. So we will give a quick demo of it. So here, for example, is our 7.5 centimeter in the white. The 5 centimeter in the white. This is the 3.8 centimeter in the tan color or the beige color. So you can see the difference there in size. Okay. Then we have the smaller ones here, the 2.5 and the 1.5 centimeter. Might be more suitable then for thumbs, fingers, things like that. You're not going to use it on anything like an ankle or a knee or an elbow. It's maybe these two on your ankles and elbows, that size. So you tear it off like any previous tape and you tear across it. Okay, so you will know what length, depending on the length of your limb and the way you're going to strap it, you know what length of a strip you want. Okay, you also, for example, if you don't have any of your small finger tape and you want to strap up someone's finger, it's like the kinesiology tape, you can tear down the middle of it. So I've made this into 2 thinner strips where then maybe I can use that for strapping up someone's finger or thumb if I don't have any of the smaller tapes. So it's quite variable and adaptable as well. So any of those tapes you can tear across them, but you can also tear down the middle. Okay, so bit of variability and flexibility within it. If you don't have the smaller ones, you can use the bigger ones. Like we said, you no need for scissors. Ideal first aid scenario, dressing room scenario, or at home as well, to use, and you don't need to be looking for scissors to use it, and away you go. Take it out of the box. So, for example, I would apply it in the same way. Like, for example, if I wanted to strap up my wrist, like I showed you before, this time it might be just a little bit more rigid. I will wrap it around the wrist. Okay, that will give me even firmer compression when you compare it to the sports tape. And sometimes that can just be a bit of personal preference, where they want really good firm compression, or if they want a bit of compression that can, where the tape will give it a little bit of movement, such as with the sports tape. So, for example, if I'm looking for a finger sprain, okay, and I want to just buddy tape my two fingers together, away we go. Okay, so I may have sprained my finger last week, okay, and I'm going to tape two fingers together because I don't want to bend back my finger again. I want to be able to play. So there we go. One finger is taped to the other. So there we go. My fingers, whether that's a sporting injury or work-related injury, you can use it for that scenario. It allows a bit of movement and gives it a bit of support. You support it to the finger beside it that it isn't injured. Okay, so that's an example where if I take off the tape, then the more tape I take off, the more my fingers can move. The more I put on, the more it restricts movement. Okay, so that's really the idea of the zinc oxide tape, that it restricts movement and that it's used for that you don't sprain your ankle again, that you don't sprain your knee joint again when you're coming back from injury, and you strap it up so you can play your game or do your activity for that desired amount of time. Yeah, so there we go. There they are. Just to recap, two different colors. Colors make no difference. All 9 meter rolls. So these ones are coming in 9 meters. So there's quite a good bit of usage out of it. Okay, and obviously will depend on the strapping that you need, whether it's heavy or light, or the joint that you need strapping. A shoulder joint will require obviously a lot more than an ankle joint. Okay, so different sizes, different colors, and different applications. This is just a summary sheet, and it's in the guide that you can get from your reps. Okay, it has the zinc oxide, tear and stretch tape, and your kinesiology tape. So it has the product codes, and it gives you just a brief description of whether it's elastic, adhesion, and movement. So going from highly flexible, kinesiology tape, which provides minimal support, to your flexible, medium, firm compression with your professional sports tape, and then your restricted, rigid tape with your zinc oxide tape. So it's on like a scale of easiest to hardest type, or limited movement to least movement type that you're going to get with your tapes. So, and sometimes you can use a mix of the two. For example, you can use zinc oxide tape and your sports tape, professional sports tape, to strap up an ankle, depending on what you want or what the player wants. So there they are, even on a color scheme, the light to the medium to the dark blue there, in terms of how much you're going to restrict that joint or that muscle. So just some of the other products that you can sell with it. The Physiologix under wrap. So as I said before, the tapes are quite adhesive and quite sticky, will stick to the skin and maybe a little bit uncomfortable for some people. Some people will tolerate taking off the tape every time they play or train. Some people will actually shave their skin. So that person who has that recurring ankle sprain and gets their ankle strapped the whole time, they will shave their leg, the hairs off their leg on a regular basis. So taking the tape off is a little bit easier. But we can also apply an under wrap. It's a foam tape that goes around the skin first, which makes it then easier. You then apply the tape over the under wrap, and it makes the tape to be removed much easier, because there's a layer of under wrap between the skin and the tape. Okay, the sporty blue cooling bandage, so it This combines ice and compression, so it has cooling ingredients within the tape, and it has compression. So you take it out of the box and you apply it. So if I have sprained my elbow, I will wrap it around my elbow. So there's no need for an ice pack, there's no need for a cold spray. I have my cooling and I have my compression straight away. So it's a dual product that has a cooling and compression effect. The ice packs and hot packs, so like we said before, particularly in the early stage of an injury, someone might need a bit of cold. We will apply the professional sports tape as a compression bandage over the skin. Then we'll put the ice pack over the layered skin and then compress down again further with the tape again. So we're not putting the packs directly on the skin. They can burn, and it's not something that the person wants, particularly after they have picked up an injury. So if someone is looking for ice packs in particular, that they may want a compression tape so they don't put anything on the they don't cause a blister or a burn. And hot and cold reusable therapy packs, so these are just very similar to the ice packs and the cold packs, except they're reusable. The instant hot and cold packs are single use, so once it's used, it lasts for about 20 minutes and it has to be disposed of, whereas the reusable ones can be used at home, thrown in the freezer or in the microwave, and you can get whether you want hot or cold. And so for someone maybe with that more chronic condition, that long-lasting pain, they want the option of heat or cold, you can give them the option of both. So that's quite a useful product for that person who has that kind of regular recurring issues, whereas the hot and cold instant packs may be for more one-off first aid scenarios. So that's it. Like we said, we have the A3 sheet there, the reference guide, which pretty much has everything we covered today. You can get it from your rep. It has all the information we have there, the product photos, the product usages, the product codes, what sprains and strains are, the R.I.C.E method. So it's all there as a reference guide for you to use going forward if you are looking to sell the products. And once you become a little bit more familiar with the products, you will find it much easier to describe them and prescribe them appropriately when that person comes through the door. So thanks for your attention and best of luck.